This audio will include the mouth, teeth, tongue, salivary glands, and the esophagus. The mouth. The mouth is also referred to as the oral or buccal cavity and is formed by the cheeks, hard and soft palate, and the tongue. The cheeks will form the lateral walls of the oral cavity. The vestibule of the oral cavity is the space that is bounded externally by the cheeks and lips and internally by the gums or gingiva and the teeth. So if you take your tongue and you put it on the outside of your teeth and go all the way around, that's the vestibule. Now the oral cavity proper is the space that extends from the gums and teeth to the fauces. The fauces is the opening between the oral cavity and the pharynx. Do you remember what the hard palate is? Yep, it's the anterior portion of the roof of the mouth. Okay, what two bones form the hard palate? The maxillary bones and the palatine bones. It is covered by a mucous membrane. Now the soft palate is the posterior portion and is located between the oropharynx and the nasopharynx. It too is covered by a mucous membrane. The teeth. The teeth or dents. Teeth or dentes, D-E-N-T-E-S, are sensory organs of the digestive system located in the alveolar sockets of the alveolar processes of the mandible and the maxilla. The alveolar processes are covered by the gingiva or gums. There are two sets of teeth or dentition. The first set is called the milk teeth or deciduous teeth. There are 20 of these, 10 in each jaw. The second set are our permanent teeth. We have 32 teeth, 16 in each jaw. Mechanical digestion in the mouth results from chewing, which is also known as mastication. The tongue. The tongue is an accessory organ, and it's a special organ for the sense of taste, which is called gustation or gustatory. This is accomplished by taste buds. The tongue forms the floor of the oral cavity and provides the following functions. It will assist in chewing, remember, also known as mastication. It lubricates food to help shape it into a ball, and this ball is referred to as a bolus, basically a rounded mass of soft, flexible, and easily swallowed food. The tongue will force the bolus to the back of the mouth for swallowing, which is called deglutition. Salivary glands. These lie adjacent to the mouth. They are accessory glands, they are exocrine glands, and they produce a watery secretion of different chemical compounds called saliva. There are 3 pair of salivary glands. The first are called the parotid glands. These are the largest of the 3 salivary glands and are located at the sides of the rami of the mandible, inferior and anterior to the ear. These become inflamed during attack of the mumps. Their secretions gain entrance into the mouth by way of the parotid duct or Stenson's duct. The submandibular glands, again these are 2 of these, they are found below the base of the tongue in the floor of the mouth. You can feel these medial to the angle of the mandible. Their secretions gain entrance into the mouth by way of the submandibular duct or Wharton's duct. The sublingual gland, again 2 of these, are located beneath the tongue, superior to the submandibular glands in the anterior portion of the floor of the mouth. Their secretions gain entrance into the mouth by way of the sublingual ducts or Rivinus duct. Saliva is a combination of different enzymes that are produced by each of the salivary gland. These consist of about 99% water. The functions of the salivary glands include the following. They soften and lubricate food. They dissolve a portion of the food so that it can be tasted, and it cleanses the mouth and the teeth. The pharynx. The pharynx or throat is a funnel-shaped organ that is located posterior to the nasal and oral cavities as well as the larynx. It is both digestive and respiratory in function and takes air from the nasal cavity to the larynx and food from the mouth to the esophagus. Digestive function is to transfer the food from the mouth to the esophagus and is composed of skeletal muscle and lined by a mucous membrane. The pharynx is divided into three parts. The first is the nasopharynx. This lies posterior to the nasal cavity and extends to the soft palate. It functions only in respiration. The second part is the oropharynx. It is the central portion of the pharynx and lies posterior to the oral cavity proper. It extends from the soft palate to the hyoid bone. This is both digestive and respiratory in function. The third part is the laryngopharynx. This is the inferior portion and begins at the level of the hyoid bone and opens anteriorly to the larynx and posteriorly to the esophagus. Again, this one is both respiratory and digestive in function. The esophagus. The esophagus is a muscular tube roughly 9 to 10 inches in length. It begins at the inferior end of the laryngopharynx. It will pass through the esophageal hiatus, which is an opening in the diaphragm. It will terminate in the superior portion of the stomach. It is the least complex section of the digestive tract. There is no chemical digestion that occurs in the esophagus, and mechanical digestion occurs as a result of peristalsis. Its function is to simply transport the food, remember the bolus at this point, from the pharynx to the stomach. The esophagus has two sphincters. A sphincter, remember, is the circular muscle that constricts an orifice. The first sphincter is the upper esophageal sphincter. This consists of skeletal muscle, and it regulates the movement of food from the pharynx to the esophagus. The lower esophageal sphincter is also known as the cardiac sphincter. It is composed of smooth muscle. This regulates the movement of food from the esophagus into the stomach. It surrounds the esophagus just as it enters into the stomach.